That if you have questions, ask your clinician, ask people that you trust. Don't believe everything that you read on the internet or from being conveyed by someone who may be misinformed. And just keep asking. I think the most effective way to take care of our health is to be as informed as possible. I'm Dr. Saralyn Mark. I am the American Medical Women's Association lead and spokesperson for COVID-19. I also was the former senior medical and policy advisor to the White House, HHS, and NASA. By training, I'm an internist, an endocrinologist, a geriatrician, and I created our first women's health fellowship in the United States.
Today, what's going on with vaccines? We have Moderna, we have Pfizer, Johnson & Johnson coming in. What are your thoughts? What are your views?
Yes, so we're at a really exciting time. Tomorrow will be the FDA Advisory Committee for vaccines, and they will examine the data for Johnson & Johnson. The preliminary data that I'm seeing is very exciting. Of course, as you mentioned, we have the 2 mRNA vaccines. There are several other vaccines that are in the pipeline. And I know the major focus has been on vaccines, but I think also we have to think about therapeutics. There's a discussion on how we can use our therapeutics more effectively, as well as get them to populations sooner. I think there's been an underutilization, for example, of monoclonal antibodies. And then the other area is diagnostics. We have been talking about diagnostics from the start of this pandemic, and I think there's an increased focus now, especially with variants, that we can try to test people a little sooner and hopefully have tests that will be effective to pick up the new variants.
What does the data suggest about existing vaccines and how effective are they against new variants?
Well, again, the data is still early. There is some talk that with, for example, the Johnson & Johnson vaccine, that it was tested against a backdrop where there were variants in the population. When the mRNA vaccines were being tested, we didn't have the variants, and we're looking at laboratory clinical studies to assess if there's efficacy. I think what we realize is that when you have a virus, it's going to mutate. That's what viruses do. So you always have to be one step ahead. I think it's also an important lesson for us as we're trying to focus more on vaccines, that basic old public health measures that we've had for centuries are very effective. And what do I mean by that? Masking, social distancing, hand washing. So I think now it's extremely critical as we begin to encounter increasing rates of variants across the country that we really enforce public health measures. It's not a time to be lax. And then the other issue is you have to look about the transmissibility of these variants as well as increased mortality and morbidity rates, and that can be quite frightening.
I haven't looked at any specific data, but I have a feeling, my own feeling. March, April, May, we were all scared of the death rates. I looked at worldometer.org, how the charts were growing for the transmission of the disease and the death rate. But at some point in the middle of last year, the death curve have flattened. Has the virus become less dangerous as it mutates, or has our doctors become better in treating and knowing what to do in early stages of the illness?
I think it's the latter. We are seeing, for example, in the UK that with the B117 strain, the UK variant, that it may be actually more lethal. And we are also seeing in some parts of the country potential hybrids between the UK variant and even the California strain. I think our doctoring has gotten a bit better. We used to put people very quickly on ventilators, and it's hard to ventilate a lung that's been severely damaged. So we're trying to, do that more effectively, as well as looking at other therapeutics, giving, for example, steroids a little later in the course of the illness, allowing your body to mount an immune response, looking at remdesivir, the use of monoclonal antibodies, and as well as people, being attuned to their signs and symptoms and hopefully getting care a little earlier in the course than rather forgetting about it, negating it, or being afraid to go. And I think there's also something very important here. The death rates among subpopulations in this country is extraordinarily high among our brown and black populations or indigenous people. And it's, again, there are a lot of reasons for it. And some of that is the inequities in healthcare. So I think there's been a greater focus to ensure that we reach out not only for vaccination, but also for access. But certainly we have a long way to go.
Moderna and Pfizer are mRNA vaccine. How is Johnson & Johnson vaccine different from them?
Yes, and again, another very important question. J&J uses an anovector virus. So it's a different platform. As you mentioned, Moderna and Pfizer use an mRNA platform. So this is different. The adenovector is something I think people are more familiar with some of our other vaccines. As you mentioned, it's one shot right now. They are testing 2 shots to see if perhaps a booster may even give a greater result. The other aspect of it is you don't need a special freezer, and there's a longer shelf life. So for remote areas, I think it's going to be extremely effective. The other, as I mentioned, with the adenovirus vector, it will be interesting to see how that will impact the durability and the duration of the immune response from the vaccine. Basically, how long and how strong will that response be? Is the adenovirus vector a bioadjuvant in a sense, stimulating the immune system as well? And then there is something that I think is extremely exciting, and I can't wait to see the data on this, is can it decrease asymptomatic infection? We know that all these vaccines we believe decrease severity of disease and hopefully hospitalization and death. But the question is, can it decrease asymptomatic transmission and infection? And that will be very, very important in really, curbing the tide for this pandemic, as well as potentially preventing some of those long hauler post-acute COVID symptoms that I described. And then I think the other issue that we have to think about is cost. Some communities are struggling, and we want to ensure that we can provide vaccines, and having a variety of different costs will certainly be helpful. So I think there are many different advantages. And then another issue, some people have allergic reactions to some of the components in the mRNA vaccines. So the J&J vaccine, because it is different, may be another option for individuals who cannot take the mRNA vaccine.
Understood. Based on what I saw, Johnson & Johnson has a lower efficacy rate. Its efficacy rate is 66.5%, something like that, compared to 92% in Pfizer and Moderna, somewhere there. What does it mean? It means that Johnson & Johnson is a little bit less effective?
No, I think you have to recall that Johnson & Johnson tested its vaccine in an environment where there were high positivity rates, high case rates for the virus, as well as variants. So it was a different environmental milieu where the vaccine was being tested. The other aspect here is that it was sort of the average. They looked at over 8 different nations. And I think the other issue is how effective is this going to be against the variants? Because we believe the variants are going to probably be dominant in this country probably within another month or 2. So that will be important. And when you look at these numbers, when you say 94% effective, 95% effective, you really have to realize it's across the age spectrum. The older you are, your immune response is a little less robust. And what we're seeing is that with the J&J vaccine, 85% decreased severity for all age groups and 100% decreased death. So I think, we have to put these numbers along the context of what you're operating against. And, keep in mind, we get a flu vaccine hopefully every year, and the average success of that is about 50%. And it's able to curb the tide in regard to influenza outbreaks.
Side effects of the vaccination. My parents got the vaccine. Mm-hmm. They had to sit in front of the doctor for 30 minutes after taking the vaccine. I think that's a great precautionary measure to catch early side effects. But side effects could develop in the future. How people shall be reporting a possible side effect, and how would we tie a possible side effect to the vaccinations that was done some time back?
So it's a really good question. We don't know, as I mentioned, about the duration and durability of the immune response, as well as long-term impact from both vaccines as well as natural infection. The CDC has implemented some really interesting measures to assess that. They have digital systems where both the patient, the public can register if they have any side effects, as well as clinicians who are monitoring patients. So they're creating these registries so that we can follow along. And keep in mind, these vaccines are not approved. They're under emergency use authorization, so they're still ongoing studies. And so we'll be able to track out for months and years to come to see how well people do.
In our correspondence, you were talking about a nursing home in Germany that was fully vaccinated, but then encountered a new strain from Britain. Can you talk a little bit about it? What happened there?
Well, the people who lived in the nursing home became infected, but interestingly, they had very mild infection, and they don't really know who brought the virus in. Was it one of the patients, or was it a caretaker? Did it spread between patient to patient, or was the caretaker infecting individuals? I think if there's any positive light in this is that the infections were very mild. And if you consider the high mortality rates that we saw in these nursing homes, that is a good message.
Have you taken a vaccine?
I have not taken it yet. I was offered the vaccine early on because I'm part of the Medical Reserve Corps, but I have an allergy to one of the components in the mRNA vaccines. So I'm hoping that the J&J vaccine will become available because I think that may be an opportunity for me. And I truly hope that everybody else gets vaccines. The one thing that I felt is when I turned down my vaccine, that I knew somebody who was going to be on the front lines was going to receive it. And what I did is I just doubled down on my public health measures in regard to my social distancing, my masking, and certainly hand washing.
We've seen statistics recently that influenza is down because everyone is wearing the masks.
Right.
So maybe masks will be sticking around for a much longer period of time.
Well, I think there's a lot we can learn from our Asian counterparts. They've been wearing masks for decades. And I know when I would travel overseas, I always found it a bit odd because we usually would only have patients in the States who were immunocompromised wearing masks. But there is something to be said for it. And I think as we get more comfortable with it and we know how to wear them consistently and correctly, we may find that they're just a wonderful tool and it's a good safety measure. So I just encourage everyone to do it, not to be afraid of it, and to realize that they're actually doing something to protect themselves. I often use this analogy that if you're going into battle, you go in with your weapons, you go in with your guns, but you also go in with body armor. And if you think of the vaccine as a gun and you think your public health measures as body armor, you have a better chance of winning the battle.
What can our government do better in order to improve vaccination rates?
Well, first of all, I think you brought up an important issue, and that's education. The first step to anything is education and awareness, and having a unified message, I think, is extremely helpful. We know everything happens at the grassroots level, so you have to utilize your resources and services that you have at the grassroots, but I think the government can put out effective campaigns. When I was with the U.S. Department of Health and Human Services, we put out many educational programs, and I saw the role that they played, and I think it's really important that we, activate that opportunity to get messages out to diverse communities. I think the other role that you can play is having coordination. Certainly will help with communities in regard to logistics as well as infrastructure and providing financial support as well. It's a very, very complex endeavor that's happening here. And I think, we're fully beginning to appreciate it as we're rolling out vaccines and we're seeing the challenges. But just like anything we do, there will be hiccups along the line, and then you get better as you go along.
In the United States, which state is doing the best vaccination efforts?
Well, I think, those numbers are changing. We initially had an issue of there was supply, but we couldn't get it out. We couldn't distribute it. And now there's an extraordinary need for demand, and we're trying to rev up the supply. We looked at some of our states like West Virginia that utilized a lot of their local pharmacies and had community interaction and found that to be effective. But as we see the distribution improve a lot because of having a good federal plan right now, we're seeing more and more states really coming online. So, for example, I'm in the District of Columbia. They've done a really good job. Maryland's done a really good job. I also am originally from Colorado and have been in touch with the Public Health Department of Colorado. They've done a very good job. So, it's if you give public health departments the appropriate infrastructure and help with logistics, I think you're going to see an effective distribution plan.
So the bottleneck is actually with the distribution, it's not the production?
Well, you look at the life cycle of a vaccine and you have certainly the development, and there was an accelerated development, and simultaneously we were beginning to manufacturing, and then you move into the distribution component of it. But distribution involves many factors. It can be infrastructure, such as the supplies, not only the vaccine, but all the supplies you need to administer the vaccine, having enough sites, having staff, people to administer the vaccine as well as do the administration of it. And then in regard to logistics, you have to look at the amount of time it takes to prepare the vaccine, to consent patients, to follow them afterwards. You also have to look at data management systems as far as registering individuals, the planning, do you have enough of the infrastructure? So if there is any weakness along that chain, then the chain falls apart or it slows down. So, you look at every component, and I think for every region there is a different issue at hand, and they're being addressed, fortunately, now.
COVID and different sexes.
Yes.
How are we different?
Well, we have a paper that was published in the Journal of Women's Health looking at the impact of sex and gender on COVID across health, IT, transportation, retail sectors, all the sectors that my nonprofit, iGiant, which by the way is an acronym for the impact of gender and sex on innovation and novel technologies. And we see it. We see mortality rates are about twice as high for men across all age groups. More women tend to have long COVID, long haulers syndrome. We see the issues of poor fitting PPE, which may be associated why over 73% of health professionals who are infected are women. We see the issues of gender and the social economic dynamics of women having to leave the workforce because they're having to care for all their family members and having to do the teaching and educating. We see it across so many different areas. And I think as we go forward, we'll appreciate it more and more. So in regard to vaccines, I'd like to see some data mining looking by age and sex to see perhaps if maybe younger women could do just as well on a smaller dosage, because we know women's immune systems are very robust. And when they tend to be resistant to infection, but once they get infected, they mount very robust responses, which, by the way, pregnant women tend not to do that for obvious reasons. So that may be one of the reasons why pregnant women are having a challenging time, as we've seen in every pandemic.
You're saying women are more likely to get infected with COVID?
No,
or they are just socially, economically positioned as a frontline workers more often in more dangerous situation to get COVID, much more likely?
Well, we think for the health professionals who are being given PPE, that the PPE doesn't fit adequately. So we believe that that is contributing to why more health professionals who are infected are women because of that poorly fitting PPE. Then you brought in an issue, and that's the frontline workers. And then you bring in the issue of essential workers who are providing our essential services, and they may not be given either protection or they are interacting more closely with individuals who are infected. So it's a multitude of different issues. We do believe women have more robust immune systems, but again, once they get infected, they mount those very robust responses, and that can potentially contribute to long hauler syndrome, which may have some relationship to autoimmunity. That if you have questions, ask your clinician, ask people that you trust. Don't believe everything that you read on the internet or from being conveyed by someone who may be misinformed, and just keep asking. I think the most effective way to take care of our health is to be as informed as possible. And keep in mind, we're learning as we're going along. In a sense, this is a great scientific experiment, for lack of a better use of words, but we're doing it in the best way possible and trying to make the best decisions. And there will be times when we'll have new information and we'll have to pivot. And it doesn't mean that what we did was wrong or malignant, but just that we're advancing what we need to do by the data that we're getting. And that's the nature of having a novel virus and being in a pandemic. And I thank you so much for having me on and hopefully helping your audience to understand a little bit more about these vaccines and about our health and how we can care for ourselves and our community.
Saralyn, thank you very much. I appreciate you being part of the show. Thank you.
Bye-bye.
Bye-bye.